So my name is Emily Hall. I am the Illinois Grassroots Manager for the American Cancer Society Cancer Action Network. I've been in this role for just under a year. This picture on the first slide here is a picture of a group of our volunteers in Washington, D.C., advocating for cancer fighting policies. So in my role, I implement all of our grassroots strategies in the state of Illinois for our cancer fighting agenda. We implement policies at the state level. So a lot of our work is focused on advocating in Springfield. And then we also have a federal team that implements policies at the federal level in Washington, D.C. So we have a huge network of volunteers. We have how our structure works is we have a couple leadership positions available for volunteers, and those are the folks that you'll see in this picture. Those are the people that go to DC with me. They build relationships with their lawmakers, and they advocate for our policy agenda. So just wanted to give a brief overview of what ACS CAN, that is the acronym for our organization. It's a bit easier to say than the American Cancer Society Cancer Action Network. So when I say ACS CAN, that is what I'm referring to. So who are we and how do we fight cancer? So we are the advocacy affiliate of the American Cancer Society. And our mission is to empower and mobilize a network of grassroots volunteers across the country to use the power of their voices and personal cancer stories to tell lawmakers to make fighting cancer a top priority in the State House and in Washington, D.C. Anyone who has a personal connection to cancer or simply a passion for fighting this disease is welcome to join our volunteer team. I'll get into a little bit later different ways that you can get involved. So just wanted to cover what some of the issues are that we're fighting for. So I mentioned we have a federal priority agenda. So we do each year, our organization comes out with what are our top priorities going to be for legislation that we'll be asking our congressmen and women and senators to support. And we also do that at the state level as well. So we'll also have a legislative agenda specific just to Illinois, and this will be urging our state lawmakers in Springfield to support our cancer fighting agenda as well. So we typically have a few policies per year that we're really organizing our efforts around. And then I get to be the one to manage our volunteers and mobilize them to take action. So all of our legislative priorities kind of fall into these 5 major buckets, which I have up on the screen. So the first one is access to healthcare. So this includes access to affordable health insurance, access to affordable cancer drugs. We are always fighting for affordable prescription drugs. We never want cancer patients to having to be paying exorbitant out-of-pocket costs, as we know that unfortunately is the case for many. So that is always a top priority of ours. We're always advocating for increased access to Medicaid, especially luckily here in Illinois. We are very fortunate that when the Affordable Care Act was passed, it left it up to the states to expand Medicaid. And here in Illinois, we chose to expand Medicaid. However, in some states, specifically in the southern states, they did not choose to expand Medicaid. And so when we expand Medicaid access, we believe that more cancer patients will have access to cancer treatment and medical care. Another thing we advocate for is oral chemotherapy. We found that in the cancer treatment process, when there is an option for the patient to go on oral chemotherapy, that typically that is a much higher cost for some reason than intravenous chemo. And we've seen in certain treatment plans that oral chemo can have much less side effects than intravenous chemo. So we call it the oral chemo parity. So we're advocating that if an oncologist decides to prescribe their patient with oral chemo, that will be the same cost as their intravenous chemo, and that they will not end up with a huge out-of-pocket bill. Our next bucket here is cancer research funding. This is something that we are asking of the federal government every single year. We are asking them to continually increase their funding for the National Institutes of Health and the National Cancer Institute, which falls under the NIH. And these are two of the large government agencies that provide billions of dollars in funding to cancer researchers across the country. So we are always asking for an increase in that funding because we know how vital research is to discover the next treatment and ultimately cures. And we also are advocating for funding for the Centers for Disease Control and Prevention. The CDC does have some cancer prevention departments, so that's what we are advocating for funding for those. The next bucket that we're always advocating for is quality of life. So what falls under that is pain relief for cancer patients, as well as palliative care. And if you're familiar with palliative care, this is really working to increase cancer patients' quality of life and helping to coordinate care and navigate, all of the complex medical needs that come with having cancer. So having providers there that are helpful to navigate to see all the different providers that you might need to see throughout your cancer journey. The next bucket that we're advocating for is cancer prevention. So we are advocating for funding for programs such as the Illinois Breast and Cervical Cancer Program. I'll get into what that is a little bit more. So that's what we're doing nationwide. We always want women to have access to mammograms, to cervical cancer screenings, because we believe screening and early detection is the best way to prevent and treat cancer if it's caught early. We are also advocating for some colorectal cancer screening policies, again, to catch colon cancer as early as possible, because we know when it's caught in the earlier stages, it is much more treatable and curable. Another campaign of ours is global cervical cancer. We see a much lower rate of cervical cancer here in the United States, and that is because people in the U.S. have much more access to the HPV vaccine, which covers the strains of many HPVs, which can lead to cervical cancer. However, when you're looking at countries in Africa, such as Uganda, people living there do not have access to the vaccine like we do here in the U.S. So we are advocating at the national level for Congress to provide funding to end global cervical cancer, to get education and to get that vaccine more readily accessible to people living in those countries. Because we have this vaccine, we do not believe anyone should be getting cervical cancer because of HPV when we have this vaccine. So that is one of our major campaigns going on right now. And then two others in our cancer prevention category would be preventing skin cancer. Here in Illinois, we don't have to worry about this, but our neighbors in Indiana, my colleague who is the Grassroots manager there, they are running a indoor tanning campaign, because believe it or not, in Indiana, you only have to be 16 years old to go tanning. And we know that tanning beds and indoor tanning are linked to skin cancer. Here in Illinois, you have to be 18. So in states where the laws are not as they should be, we run campaigns to advocate for the age to indoor tan to be raised to 18 years old. And then we do have a healthy eating and active living campaign. So that includes having food nutrition labels or having calorie counts just to help, prevent obesity and just promote healthy eating and active living. And then the last one here is tobacco control. ACS has been a part of the tobacco control fight since it started. We really have been, this has been one of our bread and butter legislation pieces, and some of the policies that we advocate for include regulating cigarettes, regulating e-cigarettes. We've seen vaping has just been on the rise in recent years. There are thousands upon thousands of middle schoolers and high schoolers now addicted to e-cigarettes because of big tobacco and companies like Juul using their marketing campaigns targeting those age groups. So we are really fighting to regulate e-cigarettes. We have been doing a campaign to eliminate all flavored e-cigarette, all flavored tobacco products actually, from the market, because we see that those flavors are marketed towards children. There are ridiculous flavors. I believe there is a unicorn vomit flavor e-cigarette, and there's cotton candy and bubble gum, all of these candy and dessert-like flavors that are very clearly being marketed towards children. So those are some of the things. We have been huge advocates for smoke-free. I believe when was smoke-free Illinois passed? I believe 2008. So we're big advocates of keeping all indoor spaces smoke-free. And we're also always advocating for more funding for the tobacco quit line, for smoking cessation and prevention services. In Illinois, we had a huge win in 2019. We had 3 major pieces of tobacco control legislation passed and signed by Governor Pritzker. So actually, April 7th of 2019, so yesterday was our 1-year anniversary, Tobacco 21 was signed by the governor into law, which increased the the age of sale for any tobacco product to the age of 21. We also got a $1 per pack cigarette tax passed. And by raising taxes, we hope that will prevent more people from smoking, because obviously that increased the cost of the tobacco product. And then we also got e-cigarettes to be taxed as well. And one of the things that we are working on this year is to get e-cigarettes to be included in smoke-free Illinois, since we've seen the use of that on the rise. And we did get that passed, which is exciting. So those are kind of all of the things that we really prioritize, and what pieces of legislation that we are actively working on. So like I mentioned, we advocate at the federal level in Washington, D.C., where we are asking our United States senators and our United States House of Representatives to support our legislation. Every year we come out with our federal agenda. So this year, this is a snapshot of part of our agenda and our major campaigns that we're working on. So we, ACS CAN, has really taken a commitment to health equity. We are making sure that all of our policy campaigns are through a health equity lens. And just a little summary up here is ACS CAN is committed to supporting initiatives in research, prevention, detection, and provision of patient services to reduce disparities in cancer that will lead to healthier outcomes for cancer patients and survivors. Cancer affects everyone, but it does not impact everyone equally. We do see quite a bit of cancer disparities. And unfortunately, I should have put the slide in here, but I can share some data about what those disparities look like afterwards. So our major focuses at the federal level this year are these 3 campaigns. appropriations for cancer research and prevention. So like I talked about, advocating for increased funding for the NIH, the NCI, and the CDC's cancer programs. Tobacco control. We are working to, we have some national legislation that actually just passed the House about a month and a half ago. And it's called Reversing the Youth Tobacco Epidemic Act. So we got to promote it in the Senate now, but what this bill does is it would restrict the sale of all flavored tobacco products. So it would take all flavored e-cigarettes, all flavored chewing tobacco, all flavored hookah products, and mint and menthol cigarettes off of the market and make those illegal to sell. So we're very, very proud that it passed the House this year. Obviously, these things, I'll talk a little bit how our focus has shifted in the midst of COVID-19, but these will continue to be a priority, and we will hope to get the Senate to pass this legislation once we're through this pandemic. And then our new bill this year that we're actually organizing around is our clinical trials bill. So this is supporting the passage of the Henrietta Lacks Enhancing Cancer Research Act of 2019. And we want to promote better patient access to clinical trials. So those are our major campaigns. And then in addition to that, we have some other federal priorities. And I did share our federal priorities fact sheet with Savina, so she will be sending that out to everyone after this call. So if you wanted to learn more about our priorities, but a couple more to highlight is one of the pieces of legislation in Congress right now that we advocated for back in September when we were in Washington, D.C. The acronym, we call it PACHETA, which stands for the Palliative Care and Hospice Education Training Act. So this legislation is to facilitate access to palliative care and coordinated care management for cancer patients. So this is a piece of legislation we've been working on for a number of years. Sometimes it does take quite a few years to get these pieces of legislation passed, but we have gotten so many co-sponsors on our bill in the House, and now we are working on getting more support in the Senate. Another piece of legislation that we're working on this year is called the Removing Barriers to Colorectal Screening Act. And so this would be for patients who are on Medicare. So it falls in the surprise billing category. So what's been happening right now is that when patients who are on Medicare, when they go in and get their colonoscopy, that is a preventive service. So Medicare covers that fully because it's cancer screening, cancer prevention. However, if when the doctor is doing the colonoscopy and they find a polyp in the colon, which could potentially be cancerous or lead to becoming cancerous, the doctor is going to remove that. If that happens, if they remove that polyp during the colonoscopy, this then gets coded as a diagnostic procedure. So all of a sudden, the patient, and then Medicare is not covering it fully. So then the patient is getting slapped with an out-of-pocket bill, which can be a couple $100s, which can be really burdensome on a lot of people. So we are advocating to get this passed, so that if this happens to any Medicare patients, Medicare will cover it fully, and no one will get slapped with an out-of-pocket surprise bill. I did mention our ending ending worldwide cervical cancer. That is another big federal priority of ours this year. So we are supporting integration of HPV vaccination and cervical cancer screening and treatment into existing global health programs. So we're really urging Congress to make this a priority. A couple other federal priorities of ours includes advancing pediatric cancer research. There needs to be much more research done in childhood cancer. So we are advocating, I believe it is called the STARS Act, to really increase our childhood cancer research. We also are always advocating for funding for federally qualified health centers. So these are health centers that receive funding from the federal government, and for people who are uninsured, they are able to go and get cancer screenings. They're really able to go and get any type of medical care they would need. And then they pay on a sliding scale rate. So that means based on their income. So if they're lower income, they would only have to pay based on what they're able to pay. So it really is very helpful for people who are uninsured and not having to go to another clinic or hospital and getting thousands upon thousands of medical bills. So we are always advocating for yearly funding for FQHCs in the annual federal appropriations process. And we're advocating for stable funding and increased funding for those FQHCs nationwide. And then our last priority here that I wanted to share was patient navigation. ACS actually does have patient navigators. I think we have 7 here in Illinois at hospitals throughout the state. And patient navigators are there to coordinate care and help cancer patients through their cancer journey and help be a resource and answer questions, be a liaison between the healthcare providers. They really are so important for coordinating cancer care. And so we want more patient navigators in cancer care, and we want patients to have more access to these incredible people. So we advocate to support policies that increase the accessibilities of patient navigators. So that is the federal agenda. And then I know everyone is on mute right now. So if you do have a question, or maybe if a question has popped up, I would maybe encourage you to send it in the chat box to Savina so she can compile those, and then we can cover all the questions at the end, just because I don't want to X out of this presentation I can't really see your guys' faces right now. So if you have a question, please send it in the chat box, and I'll be sure to answer those at the end of the presentation. All right, so next up here is our state agenda. So I just covered everything that we're advocating for in Washington, D.C. And here's what we're focused on in Illinois in 2020. So this is for our lawmakers in Springfield, and this is just state level policy that would just affect people living in Illinois. So our big campaign that we're organizing around, and up until COVID-19, we saw tremendous progress with this bill. It falls under our access to care bucket. And so we are advocating for Illinois Medicaid to cover the routine care costs of clinical trials. So what this means, routine care, let me backtrack a little bit. So the best way that I can explain this is that if someone is diagnosed with cancer and there's a clinical trial available, they will be presented with 2 treatment options by their oncologist. They'll be presented with the standard treatment of care, the standard chemo or radiation or whatever that treatment may be, or and they'll be presented with the clinical trial option if they're aware of it, their doctor is aware of it, they're eligible for it. So they have these 2 options. And if these patients are on Medicaid and they chose the standard treatment, Medicaid would cover all of their routine care. However, if they chose the clinical trial route, Medicaid would not cover the routine care. And what routine care is just standard cost of going to the doctor. So any costs that come about from having check-ins with their oncologist, any labs or scans that their oncologist would have them do, anything that's related to the clinical trial, such as the drug itself or any screenings that the clinical trial would need for its research, that is paid for by the trial sponsor, which is traditionally a research institution like a university or a pharmaceutical company. However, even if someone is still going through the clinical trial process, that doesn't mean they won't still have to go and see their oncologist and get that routine care done and those routine check-ins. So that's what we're advocating for, and I hope I explained that. Okay, it's been a few weeks since I've had to explain that, since we've kind of been on pause. So again, if you have any questions, please send them in the chat box, and I will do my best to address those at the end here. So We, this is, I've only been in this role for a little under a year. It'll be a year in July for me. But my boss is our government relations director. We just have a two-person team for the state of Illinois, and she's been with the organization for about 3 to 4 years. And she said this issue that we're working on this year is the one that is the most widely supported with the least amount of barriers. So we've seen a ton of progress. We've gotten over, let's see, this bill was introduced into the state Senate back in early February. We had about 26 co-sponsors out of 58 folks. So out of 59 senators, we have 59 state senators. So we had almost half of the state senators co-sponsoring our bill. It went to a committee. It went to the Senate Human Services Committee, and the committee had to review the bill, and then there's 10 members on that committee, and then they vote whether or not they want to pass it through committee. So all 10 members of the committee voted yes, they were in support of our bill. And then the next step would be for it to come to the Senate floor for a vote by the whole Senate. So all 59 senators voting on whether they support our bill or not. So Shayna, my boss, said she's never had a bill that she's worked on through ACS Can get supported 10-0 out of committee. So it really is a widely bipartisan supported bill. So unfortunately, just with COVID-19 going on right now, it's kind of at a, our state legislature is not meeting right now. So the bill is definitely at a standstill, and it's definitely not a priority during this pandemic. But we do expect to get this bill passed sometime next year once we're through this outbreak. So just wanted to share a little bit about that. Another thing that we're advocating for at the state level is funding for the Illinois Breast and Cervical Cancer Screening Program. And what this is this is a program in Illinois for uninsured women who there is some criteria to meet, but it's for uninsured women to have access to free mammograms and free cervical cancer screenings. So we're always advocating for funding. We always want people to have access to cancer screenings. So we will be advocating, the state legislature will be needing to pass a budget this year. That is something they will have to still do in the midst of COVID-19. And this will be part of that budget. So we will be advocating for them to maintain stable funding. And that program is funded at about $15 million per year. So we will be advocating for them to include that in this year's budget. And then just up here, kind of similar to what I talked about before, where we encourage healthy eating and active living. Locally here in Illinois, what this means is some states have a mandate for how much time of physical education needs to be included in schools. Illinois got rid of that mandate. I don't remember how long ago, but to support healthy eating and active living, we are going to be advocating for a mandate of 60 minutes per week of physical education for students across the state. And then just some of our tobacco policies here, protecting smoke-free Illinois with the legalization of cannabis this year. We wanted to ensure that we protected smoke-free Illinois by including cannabis and e-cigarettes in smoke-free Illinois so that people are not able to smoke either of those things inside. So we're advocating for that. And actually, that was something we advocated for during our veto session in late 2019, and we did get that passed. So, and then also we are advocating for protecting funding for the Illinois Quit Line and tobacco cessation funding. All right, so that is our state agenda. And as I was talking through this, I did realize I forgot to mention one thing about ACS Can as a whole. So we are a cancer fighting organization, and we're advocating for all of these policies that I just covered. However, a very important piece about us is that we are a completely nonpartisan organization. So that means we do not support any political campaigns, any politicians. We never come out in support or opposed to any politician. All of our policies, we want to get bipartisan support. We want support from our lawmakers, no matter what side of the aisle they're on. And we believe that fighting cancer should be a priority to all lawmakers. So that's an important piece to explain that I forgot to earlier. All right, so transitioning here, just with us living in unprecedented times right now and very scary times, especially for the cancer community and those who may be immunocompromised, be caregivers for loved ones who are immunocompromised. It is a scary time. And ACS CAN has really doubled down on our commitment to protect cancer patients and caregivers and survivors during this time. So all of the things that I just covered, if we were living in normal times, those would be our priorities that we'd be advocating for. However, we are in the midst of a global pandemic, and so our priorities have shifted in the last month due to this. So right now, we do have a little modified mission, which I shared in the second bullet here. So ACS CAN's federal, state, and local advocacy agenda will be laser focused on supporting cancer patients by reducing barriers and expanding access to care, accelerating access to cures, advancing opportunities for our tobacco, which includes advocating for taxes on tobacco products, and assessing future stimulus relief for nonprofits at the federal, state, and local level. So I'm sure many of you may have heard over the last several weeks, Congress met to pass emergency legislation, which was classified as the COVID-19 relief and economic stimulus bill to protect Americans and to keep the economy afloat during this global crisis. So one thing that we did a couple weeks ago is we organized our staff across the country and our network of hundreds of grassroots volunteers, and we had everyone actively advocate for federal lawmakers to include the nonprofit sector in the COVID-19 relief and economic stimulus package. You may have heard that there was some bailouts for corporations, specifically the airline industry. They got a lot of funding from the federal government. Small businesses also got a lot of support from the federal government. And so when taking a look at that, ACS, along with hundreds, it was maybe not hundreds, but a little over 100 or close to 90 to 100 charitable organizations drafted a letter that got sent to Congress and sent to the White House that said, we want you to include funding and support for the nonprofit sector. At ACS, all of our fundraising events have been canceled through the middle of May, and that is pretty universal for every single nonprofit across the country. Nonprofits are on the front lines providing health services, human services, social services for communities in the most need. So we are asking the government, please provide funding for our organization so that we are able to still meet the needs of the people that we are serving. So we did not get the funding we asked for in this round of stimulus packages. However, on my next slide, I will cover what was passed that is applicable and helpful to the cancer community. However, Congress is expected to be drafting another stimulus bill at the end of this month. So we will continue to advocate, and we are continuing to have conversations with our lawmakers and telling them how important it is for them to provide funding and support for the nonprofit sector, because especially, I'm sure if you've seen the news, you've seen food banks, how food banks are just running out of supplies and not able to meet the need in their communities. So we want to be sure that American Cancer Society and hundreds of other nonprofit organizations across the country are able to have the funding they need to continue their very helpful services during this very difficult time. So we signed on to the letter that went to Congress, and we also drafted a patient coalition letter to send to Governor Pritzker as well. So as the state is receiving funding from the federal government and they're doling that out to state agencies and state businesses, we're asking Governor Pritzker to please keep in mind the nonprofit community and the nonprofit sector and to provide support for our organization. So this is a summary of what passed in the last 3 stimulus bills. So 3 stimulus bills were passed to support the country during this pandemic. So I'm just going to go through these. These are some of the key provisions that our policy team in DC, these bills that passed were hundreds and hundreds of pages long. We have a phenomenal policy team in DC that are all policy analysts and have the experience and the knowledge to read through that really dense legislation and then turn it into layman's terms for those of us like me who find it a little bit hard to read through a really, really lengthy bill. So these are some of the key provisions that they shared with us that I wanted to share with you all today. So in the stimulus packages passed recently, we saw funding for the community health centers that serve more than 29 million Americans in over 12,000 rural and urban communities across the nation. So that would include those federally qualified health centers that I mentioned earlier, and also the local community health centers serving their local communities. The stimulus packages included up to 2 weeks of paid family medical leave, so people can take care of loved ones impacted by coronavirus or care for children whose schools have closed. The packages also guaranteed coverage with no cost sharing. So that means if your insurance is cost sharing with you, they're paying part of it, but they're also requiring you to pay part of it, so you're getting slapped with an out-of-pocket bill. So this bill required that there would be no cost sharing for COVID-19 testing and treatment. So even those who are uninsured or underinsured can get the care that they need. There was a little bit of tax relief for charitable organizations like ACS. It wasn't the specific funding that we were asking for, so we're going to continue to advocate for that. But this tax relief meant that if people are able to donate to charities during this time, they will get tax relief and they will get those donations deducted from those taxes, I believe. But again, I'm not very well versed in how the tax structure works, but tax relief for charitable organizations so that we can remain on the front lines serving cancer patients during and long after this. We want to make sure that all of the nonprofits are surviving this pandemic. And then as Congress develops future stimulus package, like I mentioned, they'll definitely be working on stimulus package number 4 towards the end of this month. ACS will continue advocating for cancer patients and caregivers, as well as the nonprofit sector. Okay. So one of the last things I wanted to talk about here was that in the midst of this global pandemic, cancer has not, and so neither have we, and by we I mean the American Cancer Society and ACS Can. So we realize how scary these times are, and we want to be a resource for the entire cancer community and connect everyone with resources and the support they need during this time. So this is taken from a handout that was created about 2 weeks ago, and I sent it to Savina, so she will send it to you after this presentation so you can have a list of the resources at your fingertips and you can check them out. But I just wanted to highlight what some of these resources are. So the first one being information. We want to make sure that the cancer community has the most up-to-date and accurate information about this virus. Information about the virus is changing all the time as we're learning more about it. So if you go to cancer.org, that is American Cancer Society's website. Please go there. We have an online hub dedicated specifically for COVID-19. with regularly updated information about the virus. There's a really great article on there called Common Questions about the Coronavirus Outbreak. And there's a podcast on there, What Cancer Patients and Caregivers Need to Know About COVID-19. So those are some pieces of information, and that is being regularly updated as we're learning more and receiving more information. And then I just wanted to highlight some of the patient and family services that ACS has going on right now. So we have our 24/7 cancer helpline. This is our 1-800 number, and it is operated by our National Cancer Institute specialists. So we call it the NCIC for short, but we have specialists, cancer specialists operating those phone lines who are incredibly knowledgeable about cancer, about resources, about treatment. They will answer any question you have about COVID-19, your cancer treatment, or just any question you have about cancer or COVID-19. Please feel free to call this number as a trusted resource. And even if they don't have an answer for you right then and there, they will do their research and they will follow up with you and get you the answer you need. So that is a really great resource to have. We have a Reach to Recovery program, and this is a peer-to-peer support program for those with breast cancer. It has moved to be 100% phone-based. We find that, when you're diagnosed with cancer, it is incredibly reassuring and helpful to be connected with someone who knows exactly what you're going through. And so that is the goal of this program, to connect women or men experiencing breast cancer so that they can connect and talk and just, be support for one another. So we have the Reach to Recovery program. We have online support groups. And we have a caregiver video series, and we have our patient navigators. Our patient navigators are essential. They are still in the hospitals, and they are still there to navigate patients through their cancer journey. So we still have our 7 patient navigators here in Illinois, still going to the hospitals every day to be there for cancer patients. So next, this is just ways that you can get involved if if you think that advocacy is something that you're interested in. I always find that advocacy is sometimes when you have a loved one, or if you're a caregiver, or if you are a cancer patient yourself or a survivor, feels like a lot is out of your control when going through a cancer diagnosis. And I really like to view advocacy as a way to take some of your power back, and using advocacy as a concrete way to fight this disease. We like to say that fighting and curing cancer is not only going to happen in the research lab, at the bedside, but it's also going to happen through legislation in Congress and in our state houses across the country. We need our legislators to prioritize fighting cancer and make it a priority for them. So that is what our volunteers do. So we'd love to have you come on board. The great thing is advocacy can be done from the comfort of your own home. A lot of the tactics we use include calling our lawmakers, sending them emails, posting on social media and tagging our lawmakers, just building relationships with them. And since, we're all at home right now, all of our legislators and their staff are at home, but many of their offices are still open and they have their staff working from home. So you can call their office number and you can still build relationships with their staff. So there still are so many things we can do in advocacy, even while we're all at home. I put my contact information here. That's my email address and my cell phone number. Since we're all at home, please don't hesitate to text me, to call me, to email me if you would like to learn more or get involved. And then I wanted to do a plug. Every year we plan our Day at the Capitol event, which is our state lobby day. And this is when we get our volunteers all across the state of Illinois to come down to Springfield. We usually have over 100 people there with us. And we are actively talking to our lawmakers about our cancer fighting policy agenda and why they need to support our issues. We do a big rally in the rotunda. We provide training in the morning so everyone feels comfortable talking to their lawmakers. However, with COVID-19, of course, this is no longer happening in person, but we are switching it to a virtual day of action on May 5th. So you are available May 5th, which is a Tuesday. We're about a little less than, I think we're about 4 weeks out as of yesterday. The day will be from 10 a.m. until 3 p.m. We're going to kick off the day with a live Zoom call for everyone to be face to face with each other. And then we'll have a packed agenda of actions you can take throughout the day, all to help in the pursuit of fighting cancer. And then we'll conclude the day with another Zoom call. So if you're looking to get involved or would just like to learn more about what it's like to advocate or, how we implement these tactics, I definitely encourage you to register for this day. The registration link is right there. I shared the PowerPoint with Savina, so she'll send this to you afterwards, but would love to have you all join us